Well, good afternoon, everyone, and welcome to our first community conversation webinar with Judy Rich and Dr. Cliff Martin, presented by TMC's We Are Champions. My name is Adeline Clemenson, and I am the current chair of We Are Champions. Our group provides important information about TMC, healthcare topics, and how we can be partners in creating a healthier community. We hope you will consider becoming a member. As you know, today's topic is all about COVID-19. I am pleased to introduce our two speakers today. As President and Chief Executive Officer for 16 years, Judy Rich ensures the smooth functioning and operational excellence of Tucson's nonprofit integrated health care delivery system, while also steering strategic development initiatives to support long-term growth and stability of the hospital. She has been active in our community and has served on several local, state, and national nonprofit boards. She is also a past chair of the Arizona Hospital Association. Dr. Clifford Martin is a board-certified internal medicine and infectious disease specialist. He is also currently the Chief of Staff for TMC. He has been TMC's version of Dr. Fauci. He graduated with honors from the University of Arizona College of Medicine and did a residency fellowship in infectious diseases at Bellevue Hospital in New York. He has spent the last 17 years associated and practicing with TMC. He volunteers in his son's school regarding COVID protocols, enjoys biking and the outdoors. I will be acting as your moderator for our conversation today and will be asking questions that have been sent in to us in advance by our participants. But before we get started with the questions, I believe both you, Judy, and Dr. Martin have some introductory comments.
Well, just to welcome everybody today and to let you know that this is a wonderful opportunity for us to see you in a different way and to share a little bit about what's going on here so that you feel like you're part of the family and the community that is Tucson Medical Center Healthcare.
Yeah, I echo that. Thank you all for the opportunity to meet with you in this way. It is a great pleasure. I wish I could see your faces to thank you in person for your support of TMC and your interest in this topic. It's been a challenging few months, as I'm sure everyone is aware, and I hope that we can answer your questions and give you a perspective on what's been going on inside TMC and with the doctors, nurses, et cetera, patients that we've been taking care of, and what kind of the pulse is right now for where we are. So I'll leave it at that because I know we'll get into much more of the details as we go along. Thank you today, though, for letting me participate.
Okay, so this is a perfect segue into the first question. Judy and Dr. Martin, can you tell us from an administrative and clinical perspective, what has the last 6 months been like at TMC?
Well, I'm going to start and then I'm going to let Dr. Martin do the clinical perspective. It has been really a roller coaster. We thought that in March we had seen some pretty bad stuff, and it continued into April. And then as we got through May, we felt that we had missed the hurricane. But as you all know, it came back very, very quickly and very violently the end of June and through the month of July. And so we really were in the trenches in a way that we have never been here before during that period of time. However, now we are in a place of calm. We are hoping that we're going to stay in a place of calm, but we're ready for whatever comes our way. Dr. Martin.
Sure. You know, there is a lot of ways to answer this question. and we could probably talk about it for a very long time, but what I think I can say is that when in March it became clear that we were going to be dealing with a true pandemic situation which could potentially overwhelm our healthcare capacity, that I had a moment where I wondered if Tucson was going to be able to handle it and if TMC was going to be able to handle it. And the reason I had that fear is because I understood the severity of what was coming our way. And I understood that as a community hospital, that our physicians that were expected to respond to this were largely in private practice, and they were not necessarily employees of the hospital, and that they would be counted on to step up to the plate in ways that other systems didn't have to worry about. And I have to say, I was overwhelmingly honored and privileged to be a part of what came through as an incredibly amazing team effort at TMC, a partnership between an independent medical staff, the physicians in Tucson that round and see patients at TMC, and working together with the administration to tackle this in a way that I think made us all incredibly proud. It was immensely stressful. There was times when I think all of us were very scared. The shortage of PPE at the beginning, I think, was the most worrisome thing for all of us, would be able to protect our patients and our staff. And through an incredibly concerted effort, we pulled it together in a way that I think is incredibly honorable. It was very scary, I think, for those of us that were in the hospital with boots on the ground, to see the second surge that Judy referred to and recognize that Arizona was the hotspot for COVID in the entire world at that time, not just in the United States, but in the entire world. And we still were able to do our best to protect our staff and keep our patients safe and take care of them to the best of our ability. And it was exhausting, and yet it made me incredibly proud to be part of this community. And so I think we could talk much longer about it. Much of the details will come up in future questions, but I think that we have a lot to be proud of here at TMC.
Thank you. The next question is it safe to come to the hospital, and are people avoiding the hospital because of COVID?
So I'm going to say yes, they are avoiding the hospital to some degree. We know that people are especially changing their behavior as it relates to the emergency department. So we have 5 levels of acuity or severity in our ED, and we're seeing that the lowest 2 levels of care have dropped off dramatically, but the other levels of care continue to go up, especially over the last 6 weeks. We're starting to get back to more normal times. I'm going to let the doctor talk about whether it's safe.
So it's a very important question because it's hard to tease out reality from sensationalism in what you hear in the media. But I can tell you that I can firmly say that it's safe to come to the hospital if you need to. That has been true since the very beginning, and it's true today as well. The reason it was true from the beginning is because we pulled together all of our resources, came up with a very quick plan, and I also did a brief radio interview with Mimi Kumler, our Chief Operating Officer, several months ago, and said the same thing. I have had to bring a family member to TMC. I brought them to TMC at the peak of the epidemic personally. So I got to see it both as a provider and as a patient family member, and was able to confirm that what I was telling people was indeed true when I came through the emergency department. That the protocols, the policies, the procedures, and the steps the staff were taking were exactly what they needed to be. And they continue to be today. I do think people are a little bit avoidant of the emergency department right now. And I think that it's always good to be prudent, but if someone really needs emergency care, TMC is a safe place to come.
So how do you screen and triage patients in the emergency room and or in your medical offices suspected of having COVID?
Well, in the emergency department, we are requesting that the patient come in alone until they're in a private room. just to decrease the number of people that are coming in. We're taking everyone's temperature, of course, and their vital signs. And if we have any reason to suspect that they are a COVID positive patient, we quickly get them out of the waiting room and into a private room. At that point, everything we do from that point on is really based on wearing the appropriate PPE so that everyone is protected, the patient, the staff, and any other patients in the ED.
Well, since you mentioned PPE, do you have all the PPE testing supplies and or hospital equipment you need? And how are you managing these supplies during COVID to ensure that you will have what you need?
We do have enough, and we were actually one of the few hospitals in the early weeks that truly had enough personal protective equipment, even though, as Dr. Martin said, we had some days with some very serious discussions led by Dr. Martin and other members of our medical staff about how far we should go. And I'll never forget the day that Dr. Martin said, everybody starting today, everybody is wearing a mask. There's no changing that. There's no exceptions to that rule. What a lot of people don't know is that Kim Moon, who's our materials manager, had actually started stocking up because of information that she had received and had 2 tractor trailers pulled into our campus and started filling them with personal protective equipment. So although there were days when we had specific things we worried about, we never truly got into a position where we were not protected.
How are the caregivers on the front line doing? What were their most dramatic impacts on your employees and how were they addressed? And did you have any employees that did contract COVID? And if so, how did you support them? And how can the general public support TMC and the frontline workers?
So I'll speak to the nurses and then turn it over to Dr. Martin for the physician piece. As far as our staff was concerned, there was a lot of fear initially. We certainly had people who said, I do not want to take care of a COVID patient, so please do not make me do that. And we honored those specific requests. And they were people that you could imagine requested not to be a caregiver for a COVID positive patient. We had just as many or more people who stepped up and said, I want to work on the COVID unit. I want to volunteer for this. This is important for me. In the first few weeks, we had about 8 people that tested positive, and we felt that we were able to track those 8 people back to a specific, what we call breach in personal protective equipment, not having the right mask on. To date, however, that number is still only 15. So after all of these months, we've only had 15 of our staff who have contracted COVID directly as a result of their work here at the hospital.
So,
Dr. Martin.
Yeah, would you repeat the question again? It was about how the staff are doing, if I remember.
Yes, right.
Yeah, and if anyone had contracted
The front line, the front line question, Dr. Martin.
Yeah, the front line.
Yeah.
So I can tell you that the physicians that were taking care of these patients kind of fell into 2 buckets. There were the physicians that were directly taking care of the patients with COVID. And I think that if you were to ask many of them how it felt at the beginning of all of this, they would say it felt like a battle. It was very intense. We didn't know what we were doing at the time medically. We knew the basics. We knew how to support people on the ventilator. We knew how to take care of viral illnesses, but there were so many unknowns that we really were using our expert clinical judgment in the heat of the moment to take care of those patients. And combine that unknown with the acuity of the patients and the number of patients and the protocols to protect themselves, it was exhausting. But I think it was a moment of heroism as well, because the hospitalists and the physicians in the ICU in particular that were taking care of them did immense, I mean, they really carried the day. They carried the day. There was another bucket of physicians that found themselves with very little to do, because as you'll recall, the surgeries were canceled, and the physicians, the surgeons that were involved in taking care of those patients found themselves to be with a lot of time on their hands. And that's why I mentioned before that the community really rallied, because many of those physicians volunteered to step up to the plate, to get emergency privileges, to be able to fill the gaps, to see patients in the emergency department or wherever they needed to be, and were ready to stand by. And fortunately, we didn't need very many of them. Our anesthesiologists actually did pull many shifts in the ICU where they typically don't work. So I think that that they all did very well. I think that at this stage now, a lot of people are exhausted. A lot of people are happy to be back in the OR taking care of patients whose surgeries had been delayed. But I think it's fair to say that the physicians in particular are now sort of starting to figure out how to regroup. What does this new normal look like? To answer your previous question, how do we start seeing patients on a regular basis in the office? How do we screen them? How do we appropriately start taking care of the routines in this new normal where COVID is still here? We need to always protect ourselves, secure the resources we need to do all of that. I think that while taking care of the patients at the bedside was challenging, we're now in a phase of reevaluation of where we're going next, and it remains challenging. But I think that that by and large, the physicians are grateful now for a moment of recuperation that we hope will last for a little while.
So most hospitals are still not allowing visitors, and I understand that TMC's current visitation policy has changed a little bit. Can you tell us what it is and what makes TMC unique with this policy?
So last week, we started allowing every patient to have one visitor between the hours of 8 and 5. And that patient's visitor has to be screened and needs to stay in the patient's room and wear a mask. We actually did window visits and still do window visits for people who aren't comfortable coming into the hospital. And until 3 weeks ago, we were having about 150 people a day come to windows to visit their loved ones. And that was a great program, and we still continue to have that. I think the other hospitals in town are now allowing visitors. We did a search of what was happening nationally, what was happening in California, and decided after speaking to other hospitals in town that it was the time for us to do this. And so I think we're all pretty much on the same page now, although we were the first people to start allowing visitors in on day of discharge, which we started that about 5 weeks ago.
Dr. Martin, this question is probably for you. What is the difference between an epidemic and a pandemic?
Well, yeah, that's a good question. I mean, in the broadest sense, they're both outbreaks. They're both widespread health issues that affect a large population. An epidemic can usually is local, and a pandemic is global. And so at its most basic, that's the difference. I mean, you can think of the HIV, people talk about the HIV epidemic, which actually is a pandemic because it infects people globally. You can have local outbreaks of certain things. This is a little off topic, but perhaps you've read in the newspaper about epidemics of hepatitis A in California, things like that. Those outbreaks are local, and we refer to them as epidemics. Pandemics are unique in history. There's very few of them. They're very interesting to read about. The most recent one that has entered our folklore way of thinking, and it's not folklore, but informs our history, is the influenza epidemic or pandemic of 1918 after World War II. So it's maybe a longer answer than you needed, but pandemics are unique in the sense that they typically are viral infections, which are spread more easily than other types of infections, and that's indeed the case with this particular one. And I think that it's an important concept to realize because pandemics require certain situations to become so widespread. In 1918, the obvious reason that there was a pandemic was because people had left war and had gone home. In this particular pandemic, our global intertwined economy with rapid air travel, et cetera, was what led to the ability to this virus to spread worldwide. And the reason I think that concept is important is because while I think we will clearly get through this as a species, as a planet, as a community in Tucson, that we're at a unique phase in history where there's really no expectation or hope that our global economy, our global society will shrink back to being local in any meaningful way. This indeed is the new normal, and understanding pandemics and the risks is going to lead us to, I think, answer new questions in the future about how we manage the realities of a global population and the health risks of viral things in the future.
So Adeline, there is no better question to ask an infectious disease doctor than that one.
I know, that's why we
I mean,
put it in there.
Right.
100 years he waited for that one.
That's right.
So we're going to get more involved now with the actual COVID. So what is the testing process for COVID? Are there differences between the testing types available for COVID? Who should get what type of test? Are COVID tests still in short supply? And can you speak a little bit to the reliability of these tests?
Go, Dr. Martin.
So that's a lot of question, and I'll try to be brief, which is a struggle for me sometimes, as you just observed. So testing is a constantly changing thing with this. And of course you'll all understand that from watching the news media, from your personal experiences. So early on, the testing that was available to us was largely from outside of the country. And so the reliability of those tests was questionable, and I think still remains questionable in many circumstances. Fast forward to today, and we now have tests for the virus that are being much more thoroughly vetted here in this country and developed in this country. So I think that the testing technology has become slightly more reliable. There are currently two types of tests that are generally used to check for COVID. There is the DNA or a PCR test, which is an amplification test that detects the actual virus material in the genetic form, so RNA or DNA, if you want to think of it more broadly. And those are the tests that we've been hearing about from the beginning. There are now also tests that are being used. For example, at the University of Arizona, they're developing technology for an antigen test, which is slightly different in that it doesn't detect the genetic material of the virus, but it detects one of the proteins made of the virus, so that you now have two different ways of detecting the virus. We're not really using other methods like viral culture to detect it. So right now we're using antigen and DNA tests, and you'll hear various terms, PCR and AAT, all kinds of things, but all of those fall into the bucket of PCR type tests. I can get more detailed if anyone wants, but I'd probably put you all to sleep. So the reliability is a tricky
Please
thing.
no.
Yeah, no, I won't do that. I wish that I could speak more intelligently about the reliability of the tests. I really do. It often takes years to develop these type of tests. And usually when a test is approved by the FDA to be released, it's been studied in large populations over periods of time. So not only do we know it's reliable in detecting the virus, but we also know whether it's reliable in predicting clinical disease in the patients that are being tested. And a lot of that is now still in works. So, the tests are becoming more reliable. If they're positive, we rely on them. There are still circumstances where patients have negative tests, and then we have to decide whether or not the clinical scenario is consistent with a COVID infection or not. And it's still an emerging thing. The University of Arizona, I understand, is developing an antigen test. I do not yet know how widely available that is, but if you were to go to be tested at the county, any of the county testing sites, or the vast majority of any clinical sites in Tucson, they would be doing one of the many PCR tests that are available.
So let me
Yeah.
follow up with, what is the Should people be tested for COVID? And if yes, where can they get the test? And does TMC offer testing to the general public, or only if you come through the emergency room or a medical office?
So so should someone get tested? So if someone is symptomatic, they should get tested. I think that's the best way to answer the question for the people listening today. If the symptoms of flu-like symptoms, loss of taste, fever, cough, etc., if you experience those symptoms, or if you've been exposed to someone who has those symptoms or has been diagnosed with COVID, then by all means that person should get tested. The larger question of should everyone be tested? How often should you be tested? Should someone who's asymptomatic, who has been staying at home mostly, only going out to the grocery store periodically with a mask, should they get tested? There's less clarity about that. As an individual doctor, I think I would say no. It's not the time to go out and rush and get tested in that scenario. It's best to just continue to do what you've been doing. In the perfect world, where we had unlimited tests and we knew exactly what they meant, we would ideally be testing everybody every day. And that would be my dream, because then we could get this under control faster, but we're just not there. So I think it's unrealistic to say that everyone should rush out and get tested right now. TMC, the good news is that for several weeks we've had adequate testing, but we don't offer, TMC to my knowledge, and correct me if I'm wrong, Judy, isn't offering blanket testing to all comers. We still are in the position where we need to use our supplies wisely and limit them to the appropriate clinical situation. So TMC currently is not a place, if you need a screening test, if you've been exposed, for example, that you should come to request a test. If you're ill and require treatment, then by all means, we would be able to test you if that was the case. Testing is really difficult, and otherwise it wouldn't cause so much excitement in the media. They love to talk about it because there's so much ambiguity about it. The punchline is seek medical care if you're sick. And otherwise, if you're healthy and you've not been exposed, don't get tested at this point.
And I think one reassurance that I could add to everything that Dr. Martin just said is that we have 4,500 people here, and we've been surrounded by COVID. And because we've taken the appropriate precautions, we just have not seen it spread through our employees. So there is a category of people that I call high anxiety people, that sometimes the only thing that will help them to move on is to get a test. And so there are opportunities to go to your primary care doctor, or to come into the emergency department, or to go to urgent care. We do have 2 urgent care centers. And if you're one of those people, there's testing available to you. But most people are going to be fine with the kind of criteria that Dr. Martin just described.
So we've been hearing about potential long-term effects of having COVID. Can you briefly explain what this might mean for those who have had COVID?
Yeah, this is an emerging area of clinical research and understanding. In the most severe cases, there are categories of patients that we're learning about, that you'll read about, that are called long haulers. You'll see it in the media, you'll read it in a variety of medical journals. They're patients that have been infected with COVID, and then for whatever reason, they have multiple symptoms that can range from ongoing respiratory difficulties to chills and fevers and body aches that can last months. It's not very common, it's very uncommon. But because that sounds scary, it's sort of captured our imagination. I would say that there are plenty of other infections that this happens with. For example, this valley fever is endemic to our area. Most people that get valley fever get over it. They may not even never know they had it, but there's a small category of those patients who developed a very chronic fatigue-like syndrome, body aches, et cetera. So not to say that these diseases are in any way similar, but this idea of a small category of patients who develop prolonged symptoms and prolonged phases of recovery is really true. The vast majority of people, however, remain very minimally symptomatic from COVID, and even those who are sick tend to recover much faster. In terms of what it means to the general population and to people who are trying to make decisions about their own personal health and the health of their families, I don't think that that really changes much. I think that the basics are still the basics, like Judy alluded to: staying home as much as you can, avoiding social contacts with people that would put you at risk, wearing masks if you have to go out, washing your hands. The mitigation strategies are the same. I really do feel for the people that are suffering some of these long-term consequences, and maybe we'll know more about how to help them in the future. But right now, it is true that some people are suffering significantly. There's small quantities of people, just like there was only 5% or less of people that get infected with this that are sick enough to be hospitalized. It is a virus that, for better or for worse, has a wide variety of presentations, which is what's making it difficult for us to tackle.
Can you speak to what are some of the most common myths about COVID and some of the most uncommon symptoms of COVID?
Sure. So, not getting too political, I think the most common myth about COVID is that it's gone or that it's not a big deal. And that's unfortunate, because when you have a virus that 50% of people that get infected, or perhaps some studies say up to 85% of people that get infected don't have symptoms, it does enter our psyche as a population to say, what's really going on here? Is this really true? Why are we making such a big deal out of this? And so that myth that somehow this is all made up or is not that big of a deal is, I think, the biggest challenge that the healthcare profession is facing. Because if you were to have come rounded with me or Judy in the hospital a couple of months ago, you would have seen an extremely different world than you were seeing out on the streets. You would have seen ICUs with every bed filled with ventilators, with people that were critically ill, with families who were at their wits' end knowing what to do. You would have seen elderly people and young people. So that is in my mind the biggest myth that's threatening us right now. There's been a variety of other unusual kind of funny things, like, was this created in a lab, et cetera, that have entered the thinking about it. There's no evidence that that's the case. These viruses have evolved in the past, and there's no evidence that this was some sort of a human-made thing.
Do you have to leave your Amazon box outside for 2 days? That's a myth.
That is a myth. That is a myth. And I think even I think at the beginning of this was a little unclear on what we needed to do. People were sterilizing their Amazon boxes with bleach and doing all kinds of things. And of course, at the beginning, it made sense. But right now, we know that the basics are the basics. Washing your hands, wearing masks. It's the preventive efforts are the biggest thing. One of the biggest misconceptions too, I think, is the promise of a vaccine. We clearly will get a vaccine at some point, and this has stimulated some really great minds across the world and across the country to look at novel ways of creating vaccines that have never been considered before, which is exciting. It's unfortunate that it took this, but it's nice that we'll have some newer technologies. But no vaccine is perfect. And vaccines do stimulate the immune response, but there is I think a national expectation or hope or myth that once we get a vaccine, everything will magically go back to normal. And it's very unlikely that that will be the case. It may calm things down. It's going to make us all safer, but it's not going to be the magic bullet that I think perhaps we hope for. It is going to come, though.
Well, that was one of our questions later on, so I'm just going to ask you to address it now. So in your opinion, you do believe that a vaccine will become available to the general public. Do you have an estimation on the time frame of that? And does TMC anticipate participating in any COVID vaccine administration program for the outpatient Tucson community when it does become available?
You know, I think, I don't want to speak for Judy. I think we're ready for anything. It's too early to say how that will be rolled out. But I'm sure if there were an opportunity for TMC to be part of that, that the answer would probably be yes, but it's too early. It's too early to plan. I of course think, so I of course think a vaccine is coming, but what form it takes and how effective it will be and the timeline I think are still up for grabs. It's always difficult in an election year to know exactly if what you're reading is accurate or not. It's just a fact. But this particular virus is an RNA virus. And the reason that's important is because RNA viruses are more difficult to make vaccines for than DNA viruses. For those of you who have gotten hepatitis A and hepatitis B vaccines at your PCP's office, those are standard and normal. Those are two DNA viruses. For those of you who have been screened for hepatitis C from your primary care doctor, you'll know that they didn't offer you a vaccine for hepatitis C, and that's because there isn't one. It's an RNA virus, and they're more difficult to make vaccines for. So this is very different than hepatitis C, but it's an RNA virus, and I just think it's going to take a while longer to make it. The record speed that we're aiming for is certainly going to be faster than any vaccine developed before, but I'm cautiously optimistic that something will be available next year.
And I would just add that I just received an email today from the Pima County Health Department asking if TMC has freezers that are minus 60 to minus 80, and I believe that's centigrade, so that we would be able to store and distribute the vaccine once it happens. As Dr. Martin said, we're still a ways away from that, but we're very open to being a part of the distribution network when that happens.
So there's a follow-up question to the vaccine. What are the prospects for natural or vaccine-derived immunity? And are you seeing any reinfections of COVID as has been reported in parts of the country?
You know, I can only speak personally that I have not, but I've kept up with the literature that says that it happens for sure. How frequently it will happen in the future, how much having had a previous infection confers immunity in the future is up for grabs now. I mean, I think that the general concept is that there generally is some residual immune response if you are infected or if you've got a vaccine, but it's a big question mark right now. There certainly have been cases of patients who have been reinfected, at least one. It seems to have been worse, but the vast majority of people do not seem to be getting reinfected. There's also a little question on the side panel that says, will we need to continue wearing masks because of limited vaccines or people who won't get it? I think that we'll see a phasing in of vaccines and a phasing out of masks over time. I'm very fond of saying that everyone should get their flu shot, but that the flu shot does not prevent the flu, it just keeps you from dying from the flu. I mean, if you get the flu shot, you have antibodies against the flu, but if you were to get infected, it doesn't mean that you would necessarily be 100% asymptomatic. You could still get a mild case or at least severe case while your immune system cranks up, and you may still be contagious during that period of time. And it certainly definitely keeps people from dying and decreases the severity. I expect that this vaccine will be the same. So even if we were to roll out 300 million doses of vaccine by the end of next year, it may be a little while longer until we see phasing out of masks over time.
So since you mentioned the flu, how will the flu season affect COVID and TMC in general?
I think the answer to that question depends on how much the community continues to adhere to hand washing and masks. We have seen a dramatic decrease in the normal respiratory viruses that circulate in pediatrics. Schools are been closed and people are wearing masks. And so we've seen a dramatic decrease in other viral illnesses that circulate like influenza does. And at least preliminarily, it seems as if the winter season in the Southern Hemisphere was much less severe for the flu. And it's probably because people are staying home and doing the things that normally prevent the flu from being spread. So I think time will tell. I think that this is probably, if you've never had the flu vaccine before, this is the year to get it. You certainly don't want to be co-infected with COVID and influenza at the same time. That would be a horrible recipe for survival, in my opinion. I hope I never have to see a patient in that situation. I think that there are two schools of thoughts. I think that people are worried that the flu season will be worse this year. I'm cautiously optimistic that that won't be true as long as we continue to do the appropriate masking and social distancing that we're doing as a community and people get the vaccine.
So TMC has certainly had their share of COVID patients. And with what you know today, what are you anticipating your COVID patient census to be in the winter? And do you anticipate that Piedmont County might have a surge of COVID and become a hotspot again? And if so, what steps is TMC taking to prepare for a surge if it should arrive?
Well, I'll take the first one first, and that is that we had 178 patients that came to us over a period of 8 weeks from something called the Arizona Surge Line. And we were the #1 hospital in the state to take patients from the Arizona Surge Line. And the Surge Line was created in May by the state health department to find a way to place every patient who was COVID positive that could not get into a hospital or an ICU in the place where they lived. So Banner University was second in taking the number of patients off of that surge line. So in addition to those 178 patients, we certainly had many, many more patients that came into the hospital through the emergency room and through other ways. I think what we're doing to get ready for what's next is we're not putting ourselves in a position where we can't quickly ramp up again. So we turned a lot of rooms into negative pressure so that we could manage the virus. All of that equipment has been safely tucked away so that we can get it out at a moment's notice. We continue to make sure we have very deep sources of personal protective equipment. And I think the learning that we have had in the last few months has put us in a position to more rapidly and more expertly respond to any patient who presents to us that we believe is a COVID patient.
So Dr. Martin, did you have anything to add?
Well, I think that it would be foolhardy to think that we won't see some type of an uptick or some sort of a surge. I certainly hope we don't. But I think that we've learned some lessons in Arizona. We've learned some lessons in Tucson. I think the answer to that question largely depends on what our community chooses to do. If you look at what happened, we saw an uptick in cases. There was the lockdown, as it's commonly called, and people wore masks, etc. And then when all of those precautions were lifted, predictably, within 3 or 4 weeks, we saw an uptick. And then Tucson, I think, led the curve in the subsequent decrease in cases after that second increase, because we, as a community, followed the mayor's, directive to mask and socially distance appropriately, and then we saw things go down again. So I think as long as our community continues to get the message that if you continue to go back to the basics, wash your hands, wear masks, do your best, you don't have to lock yourself in the closet forever, but, going to indoor places with large groups of people is ill-advised. Going out to the grocery store or, trying to live your life as normally as possible with a small number of people, using masks to go to the grocery store. If people will continue to get the message and continue to practice that, I am very optimistic that Tucson will not see a huge surge again. Minimizing, this is the wrong time to go to a concert. This is the wrong time to go to a large indoor gathering. This, as much as I hate to say it, is the wrong time to go to a large indoor wedding. Those are the things that are going to make it really difficult. So if I had any message to Greater Tucson, it would be, don't let your guard down. We're making some gains. Stick with it so that we don't see that uptick. I had one person ask me what TMC would do if we got overwhelmed again. What would you do if you had 2 patients and only 1 ventilator? And I said, you know what? We're not there right now. And my message is to the community, please don't put me in that situation. Don't make me ever have to answer that question. Just please continue wearing your mask and washing your hands, because that's an unfair question that I don't ever want to be asked. And we'll deal with it if we have to when the time comes, but we know how to prevent it. So just please keep wearing your masks. And so far it's worked.
So you touched on this with the last question, but some people are concerned about, is it safe to travel, and you know, are planes safe? What about recommendations for the holidays? You know, holidays are usually big family gatherings, but so you're said earlier that you're discouraging that.
Unfortunately, the answer is this year, yes. I don't think we know enough to say too much about it. I definitely know plenty of people who have traveled on airplanes safely. I know some airlines are not leaving the middle seat open. Those kinds of things worry me. And it's very clear that many of the outbreaks that we've seen locally in Arizona and around the world were traced back to family gatherings that were for weddings or for funerals, which are times that are extremely painful to think about not doing the way we normally do them. But it's even more devastating to think that the consequences of going to a funeral would result in other family members dying. I mean, I don't mean to be pessimistic, but there certainly is a middle way. But I unless it's absolutely necessary, I think that this is the year to keep it close to home and keep it small.
So I want everybody to know that I work with this man every day, and he's a ray of sunshine.
Yeah.
So
Yeah.
what are the most significant lessons learned from dealing with the challenges presented by the COVID pandemic? Judy?
Well, I'm gonna start by saying that what we learned was that we needed to set up a command center quickly, and we did that. And we rallied around a FEMA organization that teaches us how to respond in a disaster, called HIMSS. And it helped us to put all the pieces in place so that we could very quickly respond on every level in the hospital. So that was a very positive thing that we put into place. And of course, we took that command center down as soon as we didn't need it anymore and tried to go back to life as normal. I think that the wonderful thing that happened here was that for a 100-year pandemic, the chief of staff for the year 2020 was a doctor from infectious disease. And so we had great leadership from the very beginning, from Dr. Martin and his partners, to help us find our way through what was a very scary, very fast, and very confusing picture.
Dr. Martin, do you have anything to add?
No, the only thing I can add is that we didn't necessarily learn this, but we relearned it, is that it takes a village, it takes a team. I mean, the thing that I think came out of this is that absolutely every role was critical. I mean, Judy mentioned Kim Moon, who was our director at the hospital, who secured our PPE. We valued from the very beginning the sacrifice that everybody was made. We didn't just talk about the doctors. We just didn't talk about the nurses. We talked about the housekeepers. We talked about the kitchen people, and that were putting themselves in situations to take care of our patients. And it took a community to step up to the plate and use the appropriate precautions. So we can do it if we all commit to doing it together. It gave me a great amount of hope and confidence in our resilience as a culture and as a community.
So we talked a little bit about the vaccine, and one of our participants has written a question about research facilities that are working in tandem to attempt to develop a vaccine for COVID. Have you heard this as well? And are there many research facilities working together to do this around the world?
Judy's nodding yes. I don't want to make up an answer because I don't know except probably what you all have read. I do know the effort is becoming more concerted and more global. So I don't know, Judy, do you know any more than that? I do know the effort.
I actually believe that there are several across the world that have stepped up, that are putting the smartest virologists that they have into the lab. And so we can all feel very good about knowing that the world is in this together. This is not just the United States. And so the brightest minds in the world are on this. This is the worst thing we've ever seen. So it deserves the smartest people and the best labs and the highest research.
Judy, maybe this is a question for you, and then Dr. Martin can chime in too. Early on, I asked about how the frontline workers were doing, and now that you've had a little bit of relief, I know that lots of people stepped up and bought food for the workers and did a whole bunch of different kinds of things. What would you like to see the community do now to help TMC and the frontline workers?
Well, as Dr. Martin said, the best thing the community can do is wear a mask and keep this from ever happening again, the way that we lived through it during the summertime. Our community was incredible to us. The amount of food, the cards, we have a whole hallway with just cards that people sent to us that said, we're in it with you, we're here. I think for our staff, they really felt like they were doing important work. And as Cliff said, from the housekeeper to the person serving food, we all knew why we were here and what we were here for. But our community stepped up in a way that we've never seen before. And it was just incredibly gratifying. And I think it all comes back to, don't delay care if you need care. We did see people die from heart attacks. We did see people have strokes. We know of people who died at home because they were too fearful to come to the hospital. We do not want people to be so afraid that they put off care. And so call your physician, come to the emergency department. You will be safe, and it could save your life.
Dr. Martin, anything else?
I don't have anything specific other than to say that if you have anyone in your life who's a nurse or a respiratory therapist or a patient care technician, that an honest, sincere thank you at this point, repeated over and over again, is the best thing. I can't tell you how many times I have walked through the hospital in the last 6 months and stopped and said to a nurse or a respiratory therapist, hey, just, thank you very much. Thank you so much for being here and doing this. And how many of them have had to fight back a tear because that just expression of gratitude meant so much to them. So that's the only thing I think I can say.
So before we close, are there any pearls of wisdom you would like to share with the audience regarding COVID or TMC or anything else that's on your mind?
I don't have any pearls of wisdom except to just keep saying what we're saying, which is that this is a virus that really is stopped by wearing a mask. And it's the way we're all going to get back to some sort of normal life again someday. And then just to say again that when you're a community hospital, you need a community, and we appreciate our community and we're grateful.
It's not really a pearl because it's right in front of us, but I've said it multiple times, but in these difficult times, back to the basics, just like Judy said, wear a mask, wash your hands, thank a healthcare worker. It's really, fortunately, with this current pandemic, it's back to the basics and just focusing on what we know works. And it's the simple stuff that's working right now.
And vote.
Well, we're almost out of time, but I do want to thank Judy and Dr. Martin for taking time out of your busy schedules and for sharing your expertise and experience with us today. And I would also like to thank the TMC Foundation staff, Julie and Megan and Camille and the communications team for helping make this event happen today. And I hope we can do more of these because I think you have an interesting perspective, and being a community hospital and our only community hospital, we'd like to hear from you more often. So if you would like to become a member or renew your membership with We Are Champions, you can click on the link that we're going to send you as a thank you for our conversation today. And we have another event coming up, and I have to give it a plug. It's the first TMC Live, a virtual talk show style event celebrating and supporting TMC Healthcare, and it's going to be on November 12th at 6 p.m. And Judy will be on it again. You'll be able to take virtual tours of the hospital, I understand. You'll be introduced to some of our frontline caregivers, to some of the programs of the hospital, including something about wanting to have your child at TMC, I understand. Judy, can you speak a little bit about that?
Well, we do deliver babies here, lots of them, like 5,500 a year. So stay tuned to us on November 12th.
Okay, and then one of the upcoming We Are Champions events will be on, our educational session will be on dementia, and it'll be featuring Dr. Atifo, so stay tuned for when we're going to have that. We had to go virtual, as everybody knows, but we will pick up some additional virtual educational sessions. So again, thank you all for joining us today. Please stay safe, healthy, and connected. And thank you very much.
Thank you, Adeline.
It was a pleasure. Bye-bye.
Bye.